What is the history of electroconvulsive therapy, ECT? Have you ever wondered how electroconvulsive therapy, often referred to as ECT, came to be a part of medical history? The journey of ECT began in the late 1930s. It was first performed in 1938 in Italy. The goal was to induce controlled seizures in patients suffering from severe mental illnesses. This method aimed to replace earlier, less reliable techniques for inducing seizures. The belief was that these controlled seizures could alleviate symptoms of psychiatric disorders, particularly schizophrenia and severe depression. As we moved into the 1940s and early 1950s, ECT was typically given in an unmodified form. This meant that patients received electrical shocks without any muscle relaxants or anesthesia. The result was full convulsions, which sometimes led to serious complications like fractures or dislocations. To address these risks, psychiatrists began to experiment with muscle relaxants. One of the substances used was curare, a natural poison, to limit the physical convulsions during treatment. The 1950s brought significant advancements in ECT practices. The introduction of synthetic muscle relaxants like succinylcholine, also known as succinylcholine, and the use of short-acting general anesthesia marked a turning point. This modified ECT greatly improved patient safety and comfort. It helped prevent violent convulsions and reduce the distressing sensations associated with muscle paralysis. As a result, ECT gained wider acceptance in psychiatric treatment during this decade. During the 1950s, ECT was appreciated for being a straightforward and relatively inexpensive treatment option. It was a rapid alternative to the lengthy psychotherapy sessions that were common at the time. It proved especially effective for mood disorders like severe depression and manic depressive illness. Many hospitals used ECT extensively, and a large percentage of psychiatrists viewed it favorably. However, the widespread use of ECT also led to some overuse. It was sometimes applied to conditions without strong scientific backing, including various nervous or behavioral disorders. This, along with the early unmodified practices and sensationalized portrayals in media, contributed to a negative public perception of ECT as harsh or inhumane. Technological improvements continued into the 1960s and 1970s. The transition from sine wave machines to brief pulse devices reduced cognitive side effects like memory loss. This made ECT safer and more tolerable for patients. From a 1950s nostalgia perspective, ECT represents a notable example of medical innovation during that era. It was a time when psychiatry was evolving rapidly, with new treatments like early antidepressants and antipsychotics emerging alongside it. The 1950s were filled with optimism about medical technology's ability to transform mental health care. ECT was seen as a modern, effective tool that brought hope to many patients suffering from debilitating psychiatric conditions. The history of electroconvulsive therapy is one of early experimentation, significant advancements in safety and technique, and widespread use in psychiatric hospitals. Despite the challenges and misunderstandings, it remains a treatment with a legacy rooted deeply in 1950s medical technology and innovation.